So what can you expect after your lipogems procedure? Just to first, before I go into what to expect, I just want to just quickly chat about what the lipogems is about, or how it's done, the process, and then what to expect. So when you come to the surgery center, you'll talk to the anesthesiologist, the nurse. They'll check you in. They'll give you an IV. And I'll come in, I'll confirm which leg or shoulder or joint I'll be injecting with this lipogems injection. And then we will go into the operating room, and the anesthesiologist will give you some sedation so that you're nice and relaxed and you're comfortable. And then I will numb up the areas either in your belly or your back where I will harvest the fat. The fat harvest is very similar to a liposuction. Most people understand what a liposuction is. It's more like a mini liposuction, which means there really aren't any incisions. They're tiny little nicks. The cannulas I use are very fine, very different from a liposuction cannula, which is large bore. And I will harvest the fat. It's relatively painless. It's a little uncomfortable. That's why the anesthesiologist will give you some IV sedation to relax you a little bit. So I do the fat harvest, remove the fat, and then take it through, process it through the lipogems system. It's a very specialized system, quite an ingenious system that is able to separate components of the fat harvest that are not really necessary, such as there's oils that can cause an inflammatory reaction. There's connective tissue, fibrous connective tissue that you really don't need injected. And what's left over are these tiny microscopic clusters of fat cells that have embedded within them these cells called pericytes, which are known to be the precursors of mesenchymal stem cells, or MSCs. So when you inject these into the joint, which is what I will do once we process it, I take the syringes with the lipoaspirate, or the lipogems, and I will inject it into your joint. If it's your knee joint, I will use an ultrasound to make sure that I hit the target. I inject it into multiple places. If it's your shoulder, I'll use a fluoroscopy, which I think is more accurate than ultrasound, so that I can make sure that I hit it right into the target, the ball and socket joint, if that's what we're after, the AC joint, whichever body part it is. When I'm done with the procedure, I'll put Band-Aids in those areas and just a gauze over the belly area. So what do you expect? What do you expect after the procedure? Immediately after the procedure, you'll probably feel pretty good. The areas were numbed, so it won't be too painful. Now, I have to tell you that I personally had this procedure done on myself, so I know what you go through. I know exactly what you're going to go through because I went through it. And this is what I went through, and this will help you understand what you will go through. Your belly will be tender. That means that if you touch it and pat it and tap it, it's going to be tender. If you go for a run or you jump, it's going to be tender. And that will last probably for about a week. It's a tender belly. So you certainly don't want to be playing dodgeball or be a goalkeeper where somebody is hitting you with a ball. It's going to hurt. And even jogging kind of bothers you for about a week. Your belly does. Your joint area where the injection site was done will be tender, and it's usually for about 3 days. The first 2 days, you will have a little difficulty walking. So when you're sitting for a long period of time and you get up, you're going to say, ouch, my knee kind of hurts and it's kind of stiff. You're going to be a little worried, and that it's normal. Within 72 hours, that initial swelling goes down. The feeling of fullness goes down. Your knee will feel kind of full, which causes it to be stiff, and it will go down. So what I tell patients is, be aware of these issues. Don't worry, it's very normal. You can ice your knee as well as your harvest site. You can take Tylenol extra strength every 6 hours, and that usually helps. And you can move the joint. So if it's a shoulder, you kind of move it back and forth. If it's a knee, you move it back and forth, and that will help with post-stiffness pain. But usually after about 3 days, you'll move forward. Those areas won't hurt so much. Your belly will still be a teeny bit tender. Patients will sometimes ask me, hey, am I going to have a flatter tummy? Will my six-pack show more? I certainly wish that it would, but it usually doesn't. It actually doesn't. It's a very small amount of fat that's actually taken. And then normally after about a week or two, it's business as usual, meaning your activity is the way that it was in terms of your workouts or going to work. And then in terms of the positive effect of the lipogems, in my experience, I experienced improvement of my pain and function within 2 weeks. The inventor of the system who taught me how to do this procedure, in his experience of hundreds of patients, hundreds and hundreds of patients, in his experience the average is about 6 weeks. In terms of how long it lasts, well, we haven't been doing it very long in the United States. It's only been approved for a couple of years now, if that. So we don't have long-term experience here. In Europe, the experience, especially from the creator of the system, who has the largest database, is anywhere from 1 to 3 years or longer of a solid improvement in symptoms. So that's what you should expect. The initial recovery is a little uncomfortable, but then once that initial swelling and pain goes away, you coast after that, and then you start to experience improvement very fast. So that's it. That's what to expect with the lipogems procedure. I hope that information helped. Please let me know if I can help you in any way. Good luck with the procedure. I'll be here for you. Take care.